What is polycystic ovarian syndrome, PCOS? PCOS is a condition in which a woman's ovaries do not function properly. The function of the ovaries is to release eggs. This process is completed in two steps, that is, follicular phase and ovulation. Different hormones play a role in the release of an egg from the ovary. Ovaries have small sacs called follicles in which the egg develops. Follicle-stimulating hormone, also referred to as FSH, stimulates the growth and development of follicles. Growing follicles produce estrogen that inhibits the further secretion of FSH. Increasing estrogen stimulates luteinizing hormone or LH production. A surge in the LH levels triggers ovulation, which is the release of a mature egg from the dominant follicle in the ovary. In polycystic ovaries, there is an imbalance in hormone levels, particularly higher levels of androgens, male hormones, and insulin. This imbalance can disrupt the normal development and release of eggs from the follicles. As a result, multiple follicles may develop but often fail to release eggs, leading to the formation of small fluid-filled sacs or follicles within the ovaries. These sacs can give the appearance of a polycystic pattern on ultrasound, but it's important to note that despite the name, these sacs are not true cysts. Causes of PCOS. It's important to note that the exact cause of PCOS is not fully understood, and the condition likely results from a combination of genetic predisposition and environmental factors. Research suggests that PCOS often runs in families, indicating a strong genetic component. Hormonal imbalances, particularly elevated levels of androgens such as testosterone, are characteristic of PCOS. High androgen levels in PCOS lead to visceral fat deposition, resulting in insulin resistance and hyperinsulinemia, further stimulating ovarian and adrenal androgen production. It has been estimated that about 75% of subjects with PCOS have insulin resistance. Exposure to endocrine disrupting chemicals or EDCs, which are found in various consumer products and pollutants, has been implicated in disrupting hormone function and may contribute to the development of PCOS. Lifestyle factors such as diet and physical activity can also influence the severity of PCOS symptoms. Obesity is strongly associated with PCOS and can exacerbate insulin resistance and hormonal imbalances. A collective body of assessed research indicates that women with PCOS tend to share similar dietary habits, characterized by the consumption of numerous unhealthy foods such as processed foods, animal proteins, carbohydrates, and fats. Symptoms. There are three main features of PCOS. First, irregular periods due to disrupted ovulation. Second, excess androgen or high levels of male hormones in the body, leading to symptoms like acne, hirsutism or excess hair growth, and male pattern baldness. Third, polycystic ovaries, where the ovaries become enlarged and contain numerous fluid-filled sacs known as follicles surrounding the egg. If you experience at least two of these features, you may be diagnosed with PCOS. Understanding PCOS is the first step towards managing its symptoms and seeking appropriate medical care. Complications of PCOS. Due to irregular ovulation and hormonal imbalances, PCOS is a common cause of infertility in women. Women with PCOS are at increased risk of metabolic syndrome, which includes conditions such as insulin resistance, type 2 diabetes, high blood pressure, and abnormal cholesterol levels. Pregnant women with PCOS have a higher likelihood of developing gestational diabetes, which can pose risks to both the mother and baby. PCOS can have a significant impact on mental health, leading to an increased risk of depression, anxiety, and other mood disorders. Irregular menstrual cycles and prolonged exposure to unopposed estrogen due to anovulation increase the risk of endometrial hyperplasia and, in some cases, endometrial cancer. How is PCOS diagnosed? It is diagnosed via medical history and physical examination of the patient. Ultrasound and blood tests may also be ordered. The healthcare provider will inquire about the patient's menstrual history, symptoms such as irregular periods, hirsutism, acne, and medical history, including family history of PCOS or related conditions. Ultrasound. More than 12 follicles of 2 to 9 mm in either of the ovaries, more than 10 ml volume of either of the ovaries may indicate PCOS. Hormone levels. Blood tests may be ordered to measure hormone levels including testosterone, estrogen, LH, FSH, and DHEAS. Insulin and glucose levels. Since insulin resistance is associated with PCOS, blood tests may be conducted to assess insulin and glucose levels, including fasting glucose and insulin levels or an oral glucose tolerance test. It is important to note that there is no single definitive test for PCOS, and diagnosis is based on a combination of clinical findings and test results. Management and treatment. Lifestyle modifications are recommended as the first line of treatment for PCOS. These include healthy diet. Adopting a balanced diet rich in fruits, vegetables, whole grains, and lean proteins can help manage weight and improve insulin sensitivity, crucial for PCOS management. A 2009 study found that higher carbohydrate intake and dietary glycemic load were associated with an increased risk of infertility due to anovulation. Additionally, the dietary glycemic index was found to be positively associated with infertility. These findings shed light on the significant impact of diet on ovulatory function and fertility in women, particularly those with conditions like PCOS. Regular exercise. Physical activity emerges as a cornerstone treatment for polycystic ovarian syndrome, with both resistance and aerobic exercise offering significant benefits. Research suggests that resistance and aerobic exercise not only improve metabolic complications but also enhance reproductive outcomes and overall quality of life in women with PCOS. A 2023 study confirms the effectiveness of Pilates in reducing pain and regulating menstrual cycles in PCOS cases. Weight management. Attaining and maintaining a healthy weight through a combination of diet and exercise is vital for PCOS management. Excess weight can worsen hormonal imbalances and insulin resistance, so maintaining a healthy weight is the key. Medications. The management of PCOS is highly individualized and tailored to the specific needs and priorities of each patient. While there is currently no ideal or definitive treatment for PCOS, symptomatic therapy is the mainstay of management. Birth control pills. Oral contraceptives containing estrogen and progestin can help regulate menstrual cycles, reduce androgen levels, and improve acne and hirsutism. Anti-androgen medication. Medications such as spironolactone or flutamide may be prescribed to reduce androgen levels and alleviate symptoms like hirsutism and acne. Insulin sensitizing medications. Metformin, a medication commonly used to treat type 2 diabetes, can improve insulin sensitivity and regulate menstrual cycles in women with PCOS, especially those with insulin resistance or prediabetes. Fertility medication. For women trying to conceive, medications such as clomiphene citrate or letrozole may be prescribed to induce ovulation. Nutraceuticals. Evidence suggests potential benefit of myo-inositol and D-chiro-inositol for certain metabolic measures and ovulation in women with PCOS. Vitamin D supplementation has emerged as a promising complementary therapy for PCOS management. Women with PCOS are responsive to vitamin D supplementation with moderate doses, showing robust results. N-acetylcysteine is effective in improving metabolic parameters in women with PCOS, making it promising nutritional supplement for PCOS treatment. Results of a meta-analysis suggest that omega-3 supplementation may effectively alleviate metabolic disturbances associated with PCOS. Early holistic treatment of patients with PCOS is crucial to help them cope with mental stress due to this disease. Women with PCOS can still live a healthy, active life and prevent long-term metabolic and cardiovascular complications with early diagnosis and long-term management.